Deborah Cabrera, your psychiatric nurse practitioner student today, and I'll be conducting your visit. So before we get started, I just want to make sure that I have consent from you to participate in this recording.
Yes.
Okay. What's your first name and last name?
Full name is Carlos Rafael Reyes Landestoy, and my birthday is 8/31/94.
Okay, perfect, Carlos. And do you know where you're located today?
Yes, in the hospital.
Okay, perfect. Do you know what date is today?
Yes, on July 14, 2025.
Okay, perfect. And do you know who's the president this year?
Yes, Donald Trump.
Okay, perfect. Okay, so we are gonna continue with the assessment. Everything in your chart I was going over, everything looks good. So I just wanna ask you some routine questions about mental health, just to make sure that everything is okay, in case that we need to take care of your mental health or prescribe any medications to make you feel better. How have you been feeling recently?
Yeah, I'm feeling good.
You're feeling fine, no sleep issues,
No.
depression, anxiety.
No.
Have you been having any thoughts about harming yourself, any suicidal ideations?
No.
Okay, perfect. Have you been having any changes on your medications? Have
No.
you still taking your Metropolo, the same dose and atorvastatin?
It's the same. It's
Okay.
normal.
Perfect.
No.
Okay. Well, I'm gonna ask you some questions. I'm gonna be doing some neuro assessment. We're gonna also check your abdomen, and we're gonna make sure that everything is good during this visit. Okay. Okay. So I'm gonna first start by asking you if you could please cover your eye with one hand, and you're gonna follow my finger. Okay. Okay. Perfect. Now the other one. Okay, sounds good. Now I'm gonna proceed to ask you if you could please elevate your eyebrows. Okay, perfect. Can you please now smell this?
Alcohol.
Okay, perfect. Okay, now you're gonna open your mouth and you're gonna move your tongue to the side. Okay, perfect. Sounds good. Now I'm gonna say a word and you're gonna repeat it after me after I do it on both sides.
Okay. Baseball.
Okay, perfect. I'm gonna put some resistance on your shoulders. You're gonna turn your shoulders against resistance. Okay, perfect. Okay, sounds good. Now let me see your arms. Okay. Okay. Does this feels the same on both arms?
Yeah.
Yes. Okay, perfect. Okay. So now I'm gonna go ahead and I'm gonna ask you to please lay down on your back, and I'm gonna do an assessment of your abdomen. We're gonna also put your abdomen, palpate your abdomen. Do I have permission for that?
Yes.
Okay, sounds good. Okay. Okay, now I'm gonna palpate. Does anything hurt? Do you feel any pain, any discomfort?
No. I feel good.
Okay, sounds good. Okay, I'll be percussing right now. Okay. Okay, Carlos, so everything is good with you. I just want to make sure that if you have any other concerns, we can address it right now. Any issues during the whole visit?
No.
Okay, perfect. So I'm just gonna schedule your next visit with us. If you have in the meantime any changes on your mental health, if there is any issue, if there is anything that you want to talk about it, I just want to reinforce that we are here. We are here to take care of you, and do not hesitate to give us a call and schedule an appointment with us. Okay? Perfect. Thank you. So it was a pleasure meeting you. During today's visit, my 31 years old male patient was seen and evaluated for a routine checkup. The patient appeared stable with all findings within normal limits. Patient was alert and oriented to person, place, time, and situation. He was alert and oriented times 4. His mood was described as stable His affect was appropriate. There were no signs of acute distress or any behavioral concerns were observed during the visit. Patient also denied any suicidal ideation, any self-harm, or any like significant mood disturbances. He also reported no change during sleep or any appetite or change or significant change in energy levels. Basically, the cognitive assessment, patient demonstrated intact memory and abstract thinking. His cranial nerve and exam and motor sensory checks were also within normal findings. The abdominal exam was completed as well. I want to mention that this patient is obese. There were no visible scars or any abnormalities. Bowel sounds were present in all 4 quadrants. No prudes were appreciated. Percussion indicated in panic appropriate areas, and the palpation revealed no tenderness or any mass or guarding. Genital exam was not performed on camera in respect of the patient's privacy. However, all the findings were documented as normal. Patient denied any discharge, any bleeding, any swelling of the testicles, any difficulty urinating. The patient didn't have any further questions, and there was no safety concerns at this time from me as a provider.